Hey guys, my name is Travion Joyner, and today I'll be talking to you guys about COVID-19. In the next slide, I'll be talking to you guys about how COVID spreads. So COVID spreads due to droplets getting launched out of someone's mouth, out of an infected person's mouth that has COVID-19. So usually how the droplets get launched is they're either coughing, sneezing, or just simply talking without like any masks or anything over their mouth. So then they'll just launch the droplets in the air, and then whoever comes near in that area or walks in that area from after someone sneezing or coughing or talking, they will eventually get infected due to inhaling the droplets from the infected person that has sneezed or coughed. And then next one, I'll be listing some symptoms of COVID. And first, you got fever or chills, then you got coughing, shortness of breath or difficulty of breathing, you got fatigue, you got new loss of taste or smell, sore throat, congestion or runny nose, and then nausea or vomiting. And when you are exposed to COVID-19, you don't get these symptoms right away. Like 2 to 14 days after, you will get these symptoms, and then you basically will know that you got infected with COVID-19. And some other symptoms that I don't have on here are diarrhea, some headaches, or muscle and body aches. And then next, I'll be talking to you on how to prevent from getting COVID. And according to the website Centers for Disease Control and Prevention of How to Prevent from Getting Sick, last updated November 17th, 2020, it says to wear masks, stay at least 6 feet so the droplets that I was talking about earlier don't infect other people, and by doing this you would at least decrease the amount of people that get infected. And then also to wash your hands, and if you're not like near a bathroom or a sink and you can't use soap, you can use hand sanitizer also. And the picture I have right here also includes leave home only for essential work or necessities. So don't leave your house if you don't really have anything to do. Do when you have like important stuff like getting groceries, or if you really have to go to work. But then also it does say that you should work remotely whenever possible, because by doing this it prevents you from seeing the infected people, so then you would get infected also. Then down here it says disinfect frequently used items and touch surfaces often. So if you're at your house and you have a family member that is sick from COVID-19 and they're in their room or came out for like a second, you want to disinfect anything that they have touched recently or a surface that like they might have coughed near or sneezed. And next, I'll be talking about vaccinations for COVID. And according to the article Clinical Trials Arena by Kezia Parks, last updated April 23rd, 2021, she talks about how people would get different kind of doses, so they would mix their doses. And the reason why they did this was because there were shortages from people trying to get their vaccination for COVID. So there would be like different kind of vaccinations. Some are called Pfizer and Moderna, and another one was called Johnson & Johnson. And the Moderna and Pfizer have 2 doses. So someone would take the first dose and then have to come back 2 to 6 weeks later for the second dose, so then you can complete it. But then sometimes after the first dose, they don't have like another Pfizer dose for your second dose when you come back, so they have to mix it. And she was explaining how good or why people have to mix it, and if it's good for you or not. And then
after you take both of the doses or the one from Johnson & Johnson,
It works after 14 days,
after you got your shot.
and then now I'll go over all the main points or main topics that I have talked to you about. So first, I talked about how COVID spreads. I said the infected people who sneezed or coughed or just talking in an area, they launched some droplets that people can inhale and get COVID-19 from. And another one was the symptoms of COVID. Some symptoms I listed were diarrhea, headache, muscle or body aches, fever, coughing, loss of breath, loss of taste, and then I also talked about how to prevent from getting COVID. I talked to you about but I talked to you that you should wash your hands with either soap, or if you can't get soap, get a hand sanitizer, wear a mask, stay 6 feet, and then last but not least, I talked about vaccinations for COVID. I talked to you about how a girl by the name of Kezia Parks said that not everybody gets the same dose, and they mix them sometimes when someone gets their second dose, and she talked about how it might not be good or bad for doing that. Okay, thanks for listening.